On today's episode of Plastic Surgery Uncensored, Dr. Roddy Raban, board-certified plastic surgeon from Beverly Hills, is exactly where we're sending you all of this information. In case I didn't say it sooner, this is where we're coming from. We're going to talk about noses and chins. Because when you turn your face sideways, it's all about the profile. High profile, Facebook profile, your profile. This is, again, I keep saying it over and over because I love how straight to the point you are. Of Plastic Surgery Uncensored, we're going to cover noses and chins because noses and chins kind of go hand in hand. They're the part of your face that jut out, that kind of define you. So how much of your practice would you say is noses and chins, Dr.
Yeah,
Raban?
I mean, it's probably my favorite part of my practice. It's probably maybe 40% of what I do. The reality is that the reason why we lump them together is, why are we not saying noses and ears, right? Or noses and eyelids. The reason we do noses and chins is because the profile, as you were referring to, meaning your entire side view, is going to be predicated on the structure and the balance between your nose and your chin. And they're sort of like relatives or cousins. And they're not just neighbors, but rather cousins. And so in order for you to get great outcome from one or the other, you need to at least have discussed both of those issues.
Yeah, well, a weak chin is considered a weak character. I mean, it's an important thing. They really do define you. In fact, I have a friend who's a very handsome guy, and one of my girlfriends told me I couldn't date him because of his nose. Like, his nose ruins his whole face. I can't send him to you because that would mean I'd have to identify him. So That being said, let's talk about when people's noses get ruined. We've all seen celebrities who thought they were going to look better, and they went south. Can we name names? Can we talk about it?
You can name names, but I mean, the reality is, it doesn't actually. The irony is that when you say botched nose job, the average person immediately is going to turn to a celebrity in their mind. They're going to think of their most memorable celebrities, because we look at celebrities, we look at their images.
Sure.
When things go good on them, we want to emulate them. When things go terrible, we want to avoid them. And so a lot of people who come in for a rhinoplasty, the first thing they say to me is, "Oh, but I don't want to look like so and so," which is basically they're saying, "I don't want to look terribly done or overdone." And so, what I tell them, there's some basic principles. Let me give you some of the 411s of rhinoplasty, okay? And then we'll move to chins afterwards. So the first thing you got to know about rhinoplasty is that, traditional rhinoplasties, the old school rhinoplasty, was done in a way in the 30, 40 years ago, which is called reductive. So what does that mean? Reductive means exactly what you think it means. It means you would walk in, say, my nose is big, I don't like it, and I want a small nose. I want a cute nose. I want, in an instance of a woman, a feminine nose. And so what the doctors would do is they would go in and they would remove all the aspects of your nose that were prominent, the big hump, the big tip. And what would happen is, yes, indeed, you would be ending up with a smaller nose. The problem is your nose is a building. It's a structure like a bridge or whatever. And what would happen over time is the nose would start to collapse, and you would start to see the things that we see all the time, which is the tip would become really narrow and pinched. The nostrils would start to fall inwards. The bridge would get narrow. And those are all the telltale signs of a done rhinoplasty, right? So you don't need to be a doctor to be like, "Oh my God, that woman had her nose done and wow, that's bad." And so, yes, they didn't know any better, and that was 30, 40 years ago. But the overwhelming majority of rhinoplasties done today are still being done that way. The problem is that we've come a long way. I mean, we do heart transplant, we do all kinds of, we do conjoined twins, and rhinoplasty is no different. And we have a lot of advances, and yet the problem is that a lot of people aren't taking advantage of this new knowledge because of A, it requires greater skill, and B, it takes more time. And as we've said on many podcasts, time means less money. Not less money, meaning the doctor keeps less money, because the quicker you can do something, the more money you make. And so the new philosophy towards rhinoplasty is reconstructive. So yes, you're going to make the nose smaller. You're going to make it a little bit more attractive, more balanced, but you're going to add support in the nose in the areas that you've weakened, buttresses, as you would in a building or etc.
And what is that like? For instance, if you're telling me that back in the day, the way it was described to me was that they flip your nose up and they break it and they file it and all of that business. Well, how do you support that?
Yeah, that's good. So what you do is you would do some of those traditions. First of all, what you're referring to is how do we get inside the nose?
Right.
So we get inside the nose one of two ways. You do a closed or open rhinoplasty. And a closed and open rhinoplasty simply means closed, meaning you make 2 incisions in the nostril inside, so they're closed and you can't see. And open means you make the same 2 incisions, but you make one more incision across the base of the nose, which heals incredibly well. I like to do things open. The advantage of being which is the nose is opened. You literally open it like the hood of a car. And while that may sound graphic, what it does is it allows you to see what you're doing. And when you see what you do, you tend to be a little bit more accurate.
Sure.
But needless to say, whatever method you use, open or close, the idea is you, as you said, take down the hump, you break the bones, you make it narrow, you do all those things. But now what you've done is you've weakened the nose. So what you need to do is support it. And how you support it is with cartilage. And the cartilage you get is from somewhere in your body. 85% of times you get it from the septum. The septum is the cartilage in between your nose. And it turns out that most patients who come in for cosmetic reasons also have breathing issues. And so when you do a septoplasty or fix the septum, it's a twofer.
Oh.
You get to fix the breathing and you get some cartilage that you use in order to then balance or structure the nose. So you put in the cartilage from your septum and you support the areas that you know, how do I know? Because we know after 50 years of seeing this, are going to start collapsing and going inward. And you buttress them in there. And that's modern day rhinoplasty. I mean, I just came back from a meeting 2 weeks ago, and it was an international meeting of like 1,000 surgeons from Turkey to Germany.
Wow.
Everybody around the world, anyone who does rhinoplasty knows that this is the way you do it.
You don't think of, I know this sounds, you don't think of people around the world. I always think plastic surgery is an American thing. When you say Turkey, like who gets a nose job in Turkey?
Turkey is a big mecca for rhinoplasty, and there's some really excellent surgeons there. So, that leads me to my second issue, which is, you do this nose and you look at celebrities. And so first thing you know is they all have this sort of pinched, tiny little nose. And if you go on IMDb, I have this thing where I tell, first of all, when patients come into the office, I always take them through a iPad that has all the celebrities in it. And the reason I do that is I want them to see what they don't want to look like. So that's the first thing. Secondly is you just go to IMDb and let's say you pick a celebrity. Let's think of somebody.
What they used to look like versus
and you follow their transition. So you see them when they're 25, you see them when they're 30, you see them 35.
Flynn Boyle.
And then you watch their noses just like disappear.
Yeah.
It's not because they keep having multiple surgeries. It's the original surgery often starts to kind of fall inwards. So that's cosmetic. But we have this thing called nasal cripples. And a nasal cripple is an individual who went in for cosmetic purposes.
Right.
And comes out with a tiny little nose as requested and now cannot breathe. Because what is your nose really designed to do?
Breathe and smell.
Breathe. And so which breathes better, a big nose or a small nose?
Big nose.
Okay. So when you ask me to make your nose smaller, should it come as a surprise to you that all of a sudden you can't breathe? So if your surgeon doesn't give 2 shits about your breathing and all he cares about is your cosmetics and you're so enamored with getting your nose smaller,
right?
And your breathing is an orphan or forgotten, then your breathing will become compromised. And I promise you, when you become an obligate mouth breather, meaning you're forced to breathe through your mouth for the rest of your life, you will be one bummed out person. So breathing cannot be an afterthought. And the way we do all of this is through a structural approach. And I tend to do it through an open approach rather than a closed approach.
And what about, we were talking about a sort of obliterating ethnicity also. Is everybody supposed to have a small nose? Aren't some people, it doesn't match every face. It doesn't match every structure. If you have high cheekbones or a wide face, I have like a big kind of a stop sign face. I always jokingly say I have a big drag queen head. I had a nose job, as I've said on another podcast. I didn't want a little tiny nose because I thought it would look peculiar on my face.
No, and you're absolutely right. So everyone says, we'll keep reiterating my pet peeves. I hate the word natural because the question of natural is a matter of perspective and it's subjective and it's one person's natural is another person's nightmare. So, but everyone will come in and say, I want to look natural. And to me, what it means is that you want to stay congruent with some of the images. So when you're an ethnicity, Asian, Black, Latino, or Middle Eastern, the more you do, the more aggressive you are with the surgery, the more those particular features, wide nostrils, a big hump, start to disappear, the more off you go from the center of what you're more accustomed to look like.
Right.
So obviously our aesthetic goals tend to be Anglo-Saxon, more white driven, But the question is how much? A little bit of narrowing of the nostrils in somebody with really wide nostrils looks pretty good. You narrow it a lot, you look ridiculous.
Mm-hmm.
If you had a huge hump and you have all these dark features, now all of a sudden you have this tiny little scoop nose, you look ridiculous. So ethnicity is a general term,
Right.
and natural is a general term, but I think it's a matter of taste. And I always tell patients, you want a good result, go look at hundreds of photos, and if you like only like 10 of them,
Mm-hmm.
you're going to be in trouble.
Exactly.
A couple of things I'm going to tell you about noses in general. Number one, you got to expect your results. You know, you do a breast aug and in 3 months, you're going to have a result. Rhinoplasty is unlike anything else you do. It takes minimum 18 months for your result. And I think you will, if you really clock back your brain, your nose continues to change. And at the beginning, it's swollen. And while it looks good and it looks a little better, it takes a long time. So if you're an inpatient individual, don't bother doing your nose. Secondly, your skin type has everything to do with your result. So people think that rhinoplasty is magic. So let me give you this analogy. You lift up a sheet of tissue paper and you put a marble underneath it. Are you going to see that marble? Absolutely. That is, if you have thin skin and you do a rhinoplasty, you're going to see every irregularity. Conversely, if you take a big blanket and you lift it up and you put that same marble underneath it, are you going to see the marble? Not at all. So if you have thick skin, you're Latina, or you have oily skin, there are limitations to the size of the nose you can make. And if you're not realistic or someone isn't describing to you, you're going to be really bummed out. So you have to have these conversations with your patients, and you have to tell them, listen, A, it's going to take a long time for your results to show because you have got thick, oily skin.
Yep.
And B, when it's all said and done, it's probably not going to be as tiny as you think or wish it should be. And third, it should never be that tiny to begin with because you're ethnic,
Right.
and it looks ridiculous.
In all fairness to my doctor, it was many, many years ago, he did go into detail about the oiliness of my skin and the texture of my skin, and said it's going to affect your result. And I was grateful for that.
Yeah, that's good. And and that's what he's supposed to do.
Exactly. Now, chins. This is so important. A good chin can change your whole face. How frequently do people come in, males and females? Because I got to think, do men do chins more than
Yes.
women?
So
I knew it, because a good chin is just...
listen, I literally just got off the plane from teaching a course on cadavers for chin augs. That's how much I love chins. If I could do one procedure, only one, every day it would be a chin aug. Why?
Wow.
Because pound for pound, for the amount of time, money, and energy and recovery, it is the most powerful change. I mean, you literally can go from being unrecognizable to suddenly super attractive. When was the last time you flipped through a magazine, any magazine, Vogue, Cosmopolitan, any magazine, and seen a woman and or man with a weak jaw? Never. But you've seen big noses, small noses, ethnic eyelids, we've become ethnically diverse-ish.
Sure.
We have, Middle Eastern and Black and Asian models. Every one of them has a strong jaw, arguably a masculine jaw. So chins are crucial, and I get men and women, and I do it a lot in conjunction with noses because patients come in and often they're like, I hate my profile. My nose is so big. And then you look at their profile and you realize, yeah, your nose is kind of big, but your chin is also very weak, which then means your nose looks larger than it actually is.
It throws your whole face out of
Because
proportion.
it's relative. And when you do a rhinoplasty in conjunction with a chin aug in a patient who actually needs it, the transformation is unbelievable. So what do I do with chins? So what is a chin aug? Well, there's two ways to do a chin aug. One is that you use a material, usually a silicone implant, or you do something called a sliding genioplasty, which is an oral surgery thing where they actually saw the chin and slide it forward. Yes, I know it doesn't sound very good. I don't do that procedure because the chin implant is so straightforward and so reproducible and so well tolerated. That's what I do. So I make an incision right under the chin. So many patients have a scar there already from falling as a child. It's tiny. And I make a pocket and I put a chin implant in. And the chin size, like breast sizing, has to be appropriate. So you got to pick the right size and the right shape to fit the overall
It's such a
program.
small area. I mean, what is the variation of chin implants versus breast implants?
Actually, there's a lot of different shapes and sizes, and it's really important that your
Really?
doctor knows exactly what he's doing. Because, everything, if you pick the wrong size, you're going to masculine. So remember we talked about men being afraid of being feminized?
Yeah.
This is the scenario where women are afraid of being masculinized. Because when you put a chin implant in, if you do the wrong surgery with too large an implant, the women are going to feel masculine. They're going to really dislike it. But in the right size, it's amazing.
You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast. So, continuing on this episode, we were discussing noses and chins, and we covered a lot of ground about profile and sort of logistics, nuts and bolts stuff. But we have on the line one of your patients who had a rhinoplasty. Is that correct, Dr. Raban?
Correct.
And she had a deeper result. Is that a fair assessment?
I think she had a bit of a more profound result. Yeah.
Okay. Yvonne, are you, first of all, hello, and thank you for calling in.
Hello, thank you for having me.
Yay. And can you expound on that? Can you let us know pretty much what made you decide to do it? And then once you did it, what effect it had on you?
Sure. Well, the main reason I decided to get a rhinoplasty was I simply just wanted to be comfortable in my own skin and confident. And at the age of 16, I was anything but confident or comfortable. And I know at age 16 that may be common, but in my case, it was to a degree where it was really affecting my life. Like I wasn't living.
You felt like you felt like your nose was enough of a hindrance to you living it affected your confidence that much to have a nose that you weren't happy with?
Oh, yes, definitely. But it wasn't just that I didn't like my nose. It was my experience in middle school specifically. So my nose was like a huge target for the bullies, I guess. I don't know why, but I was bullied a lot in middle school. And it was mainly because of my nose. So after 3 years of being tormented by these people, my nose became more than a nose. Like every time I looked at myself in the mirror, my nose was a reminder of the experience that I went through. Like every time I looked at it, all the bad memories would come flooding back.
Wow.
And I did, yeah. And I did try to overcome this. I became this nervous, anxious, scared, depressed person that that wasn't me, but that's who I became after this experience.
Wow.
And and I would say that I did not consider plastic surgery at first to fix my problems because it was psychological and I knew it was psychological. So I did whatever I could to, after middle school, the bullying had stopped, but I still felt terrible about myself. My self-esteem was just so broken. So I thought, no, I don't want to be this scared person anymore. I want to live. So I went out, I got therapy. I avoided certain things like looking at myself in the mirror, which I know sounds pretty bad. But for me, that was how I was trying to cope with what I went through. I was just trying to let the past behind me. But for some reason, after years of therapy and doing all this stuff, I couldn't get over it. I couldn't put all of that behind me. And I realized one of those things that was a constant reminder of my past was my nose. So I started looking into plastic surgery. I did a lot of research on it, and at one moment I just thought, this is what I need to do. I need to change my nose. And I knew it wasn't going to fix all my problems. It wasn't going to make the bad thoughts go away. It wasn't going to fix my depression. But I felt something in me that I had to change my nose just to move forward. It was a stepping stone to moving forward.
Yeah,
one stepping stone.
And I think that what Yvonne was saying is so true because I do remember her very vividly. I mean, I remember a lot of my patients, but some of them I remember more. And I remember her and her mom and her dad had come. And of course, at a young girl, which is quite common, rhinoplasty is done not always, but mostly in younger years. I would say between 16 and like 25. And then the people do it later in life. But a lot of the younger patients, of course, have to have their parents help them. And I remember her parents coming to me and say, listen, because they were like, we think she's beautiful. We would never be here, but she really feels that this is something that's going to help her. And I always obviously have to engage in dialogue with the patients because, as Yvonne said, the nose isn't going to fix anything. it's just going to change the shape of her nose. But in some instances, actually in many more instances than you would imagine, the self-esteem automatically corrects itself when you start to feel pretty. And then when you have good support system, amazing parents. Look how grounded and intelligent she is. She was like this when I met her. She just was incredibly
so articulate.
Yeah, she was incredibly internalized. And you know, as a physician, there's that point where you say, well, am I going to do this and really try? Do I think I can help her or not? And I really felt that she was going to blossom. So continue on your story.
Thank you. Yeah. So, well, first of all, I wanted to get the surgery. I was convinced that was going to help me move forward. But my parents were completely opposed to it at first, like 100% opposed to it. They just, when they thought about plastic surgery, especially at my age, they thought that that's crazy. You're not doing that. That's really dangerous. But after years of like begging them, I was like, at least let's go, let's make a consultation. At least let's go hear what he has to say. At least give me that. So finally, it was around my birthday. They finally thought, okay, she really wants this, and we see that she's trying to get better, but she's not getting better, and maybe this will help. So they told me, okay, we're going to make a consultation, but we are not guaranteeing that you're going to get the surgery. So I was like, okay. So I was happy, but not getting my hopes too up. So we went to get the consultation with Roddy, and after Roddy told us about the procedure and everything, and first I want to say he was not trying to convince us of anything. He just told us, this is a procedure, this is what you're getting yourself into. He told us everything very detailed. So after that, my parents seemed very more calm and definitely more informed on the subject, because they really didn't know much about plastic surgery, especially not on someone of my age. So after the consultation, we went home, they thought about it more, and they said yes. And I was so happy. So I was finally able to get that surgery. But yeah, it was only after Roddy was able to talk to them.
Yvonne, so that's amazing, and it's great to be able to go back through that experience with you in even greater detail. Can you just tell us a little bit so that people can understand? Because, you know, people from the outside who don't, you know, there is this concept that, oh, plastic surgery you can't do plastic surgery to fix one's emotional insides. That's sort of true and not true. It's sort of true because it depends on what's the problem. And it depends on who it is, it depends on what their support system is. And I don't just make some global statement that you need to fix yourself inside. And you amongst many of my patients are, I mean, a perfect example.
So bright.
So the question I have is, so you had your nose done, and can you just share with us how your life improved, just so that people can hear because it's clear in your voice that you're so bright, but tell me how your life improved from where you were in sort of a dark place.
Well, first of all, after I got my nose job, I definitely still had issues. I still had to go to therapy because what I went through was it was traumatic for me. And I'm not saying that someone who had an experience similar to mine can just go out and get plastic surgery and they'll feel better. That's not what I'm saying. Personally, that's what helped me. So it could help someone out there who went through what I went through, but that's not going to be the case.
Well, you did the heavy lifting. You did the work after the fact.
Yeah, and the therapy.
Yes.
And your parents, and you had support system, and you were smart enough. Yeah. And we all said, remember, we said that this isn't going to, in and of itself, fix things. And you were fully aware of it, and you did your part. And then, how I know that things change is I suddenly saw a Facebook profile of yours. And then I suddenly saw that there was a bunch of pictures, and you had not a single picture online. You were non-existent.
Oh, yeah.
And all of a sudden, you were all over the place.
Yes. I was just, I changed so much. I want to say I became a whole new person. To other people, that's what they see. But I know that I didn't become a whole new person. I just became a better version of myself. And that nose job it just gave me that boost of confidence I needed. And it allowed me to put something from my past away, because it was my past that was not allowing me to move forward. Yeah, and it just so happened that my nose was what was holding me back. So
it's very true. Very
Yeah.
true that the nose is not what made you.
How old was she when she actually got Yvonne? How old were you when you actually got the surgery?
I think she was 16 on to almost 17.
Yeah.
And how old are you now?
I'm 22 now.
Whoa, this has been a while.
Oh yeah, we see her
Yeah.
all the time.
Yeah.
She's in college. She's studying physics. She's doing everything. She's amazing.
I'm doing things that I never thought I would do before. Like I'm taking on leadership positions at my college. I'm singing. I took a singing class, which is crazy because I would never have imagined myself putting myself up on a stage and allowing people to watch me and judge me while I'm singing, because that's what people do. They judge. But I would have never put myself in that position before, and now I have that confidence where I can now I feel like I can do anything. And I still get scared. I still have that fear and insecurity.
Natural.
Who doesn't? Yeah.
Yeah, everyone has them, but it's nothing compared to how it was before.
On a
So
scale of
I'm
1 to
grateful for that.
on a scale of 1 to 10, you were at a 1 of self-confidence before. What would you say you are now? 1 to 10.
My level of self-confidence?
Yes.
Oh, wow. Okay, well, before it was, this is very crazy, but I would say it was between a 1 and a 0 before. Like, I had no confidence. Now I would say it's about an 8 to 9. I still have room to grow.
Yeah.
But yeah, huge difference.
Listen, I think what Yvonne, and the reason why I thought she was such a perfect candidate is, we talk about the do's and don'ts, how to protect yourself, make sure you navigate the landscape of having your nose or chin or any procedure done. But I really feel when the right person is operated on by the right surgeon and the right surgery is done, the impact is so much greater than the physical visibility on the outside. And I think she is such a beautiful demonstration of the transformative power of plastic surgery. And we really appreciate you coming here, A. B, I really appreciate you being courageous and always sharing your story. And I am so lucky to be a part of the whole experience.
And that 8-point jump, that's an 8-point jump is an 8-point jump. Congratulations.
She's headed to 12. I can tell you that.
Yeah, for sure.
Yeah.
Thank you so much, Yvonne. Your story is inspiring. It's exciting and inspiring.
It really
Thank
is.
you.
Dr. Raban, on this particular podcast, we talked a lot about noses and chins. And I loved so much hearing Yvonne's story and how her nose impacted her so strongly. And then when she changed her nose, she felt so much more self-confident. She had actual rhinoplasty. But then I remembered, note to self, one of our other patients in another episode, Jeff, talked about a liquid rhino, something that, what is that?
So, I mean, essentially what it is historically you did a rhinoplasty, you had surgery. We rearranged the structure of your nose.
Yeah.
Today, with the advent of fillers, in particular, the hyaluronic acid-based fillers, like, for example, Restylane, which is the filler you can, in some patients, depending on their anatomy, inject some filler to change the shape of the nose, which is now called a liquid rhinoplasty. So you're basically changing or altering the shape of the nose using filler instead of actually doing surgery. Obviously, the advantage of that is that it's essentially no downtime, relatively no pain, much more cost effective. Not everyone's a candidate, and you still have to know exactly what you're doing because the anatomy of the nose is very tricky. But yeah, that's called a liquid rhinoplasty or liquid nose job, and it works.
Thinking about how that would work.
Yeah, well,
It doesn't affect the breathing at all?
No, it's all on the outside, but you gotta be savvy. You gotta know what you're doing, but definitely can make a huge difference.
Wow. Okay. So we have thoroughly covered for this time because I'm sure new stuff.
It'll come back.
It'll come,
It's
especially since you said you
it's
love
one of my
chins.
favorites.
Exactly.
We'll revisit this, I promise.
Great. So we're gonna wrap up noses and chins for today. We'll come back to it on Plastic Surgery Uncensored with Roddy Raban, plastic surgeon, board certified, Beverly Hills, with a great nose and chin. You're
Terrible nose.
No,
I
I
actually leave these so that I can demonstrate to
No,
patients. If I had surgery.
No, great nose. If you loved Plastic Surgery Uncensored, and I'm sure you did, I don't even want to say if, we would love to get your feedback. If you enjoyed and found our podcast helpful, tell us why. Give us the review and subscribe on your favorite podcast platform. We can be found on Apple Podcasts, Google Podcast, Spotify, iHeart, or you can go directly to revolverpodcast.com. If you have a topic you would like us to talk about, then please reach out to us on Facebook, Roddy Raban, Instagram at Dr. Roddy Raban, or RoddyRaban.com. You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.